So, today I want to talk about hospitals closing children's units in order to boost profit margins. Now, in a society such as ours, where money and profit are dominating factors in almost all things, it should come as no surprise that the US medical system is also set up in a for profit manner. Now, while the goal of a hospital should be to provide the best healthcare possible to patients and to save lives regardless of the cost, financial realities under capitalism make it so that hospitals, even the not for profit varieties, have to prioritize keeping enough money on hand for survival and investment in more and more expensive equipment. Naturally, this leads to facilities seeking options that either cut costs or attempt to boost their sales. And the devastating reality of this over the past 20 years or so has been that children's units have been shut down in favor of more profitable adult units. Now, when we add to this the possibility and, of course, current reality that we're experiencing of a mass spike of respiratory illness in children all at one time, we can see how this financial based decision making comes to harm children in the long run, and really patients of all kinds. But today we're going to focus on the children. So, to explore this more, we have here an article from the New York Times, where they write hospitals around the country, from regional medical centers to smaller local facilities, are closing down pediatric units. The reason is stark economics. Institutions make more money from adult patients. This is just disturbing to me. The idea that we're deciding whether or not a child should have a bed in a hospital because they're not profitable is just absolutely vile to me. But what we're seeing here is in April, Enrico Doctors Hospital in Richmond, Virginia, ended its pediatric inpatient services. In July, Tufts Children's Hospital in Boston had followed suit. Shriners Children's New England said it will close its inpatient unit by the end of the year. And pediatric units have also closed in Colorado Springs, Raleigh, North Carolina, and Doylestown, Pennsylvania. They're asking, should we take care of kids we don't make any money off of, or use the bed for an adult who needs a bunch of expensive tests, said Dr. Daniel Rauch, chief of pediatric hospital medicine for Tufts Medicine, who headed its general pediatric unit until it closed over the summer. If you're a hospital, that's a no-brainer. So the fact is, these hospitals are making this decision in order to exploit the fact that the expensive tests that adults need, including these surgical procedures that they often need, are far more valuable than anything that a child could potentially need. A child coming in to get, say, care for an asthma attack isn't going to provide the type of value for the hospital that someone who's an adult coming in for extensive testing for blood work or anything else might provide for the hospital, especially if that leads to a surgery. Now, when we look a little further into this, we do find that many hospitals have converted children's beds to adult ICU beds during the course of the COVID pandemic, and now are reluctant to change them back. And while we don't specifically have data to talk about and analyze the time between 2018 and the present when the pandemic had been in full swing, we do have to address the fact that between 2008 and 2018, we do have some data to show that a lot of the beds that were available to children have disappeared. And because of the trend of the pandemic, we can assume that this has likely gotten worse in recent years. But when we look at that data from the availability of pediatric services in the United States, we actually find that according to the results, that pediatric inpatient units actually decreased by 19.1%. Furthermore, pediatric inpatient unit beds decreased by almost 12%. Now, this was, a disturbing amount to see that decreased over such a short span of time as 10 years. However, the ICU beds seem to increase by 16% at children's hospitals alone. Now, while this is an important piece of data, we do have a reason to analyze this, and this uptick in ICU beds isn't necessarily the good thing that it sounds like. Now, rural areas experience steeper proportional declines in pediatric inpatient unit beds, with negative 26% versus negative 10%. Most states experience decreases in both pediatric inpatient unit beds and pediatric inpatient days. Nearly 1/4 of US children experienced an increase in distance to the nearest pediatric inpatient unit. And that to me is one of the most disturbing Trends. If you have a child who is in need of being seen in a hospital, outcomes could get significantly worse by having to travel further or by having a situation where it might take more time. Both of these are occurring between 2008 and again 2018 in a quarter of US children. And again, this is again likely to have gotten worse since the pandemic happened. Low volume pediatric units and those without associated PICU were at highest risks of closing. So, what we're essentially seeing from this data, just to summarize it all, is a decrease in total beds that are available for children for any sort of inpatient care, which again is quite disturbing. And while we're seeing an uptick in the amount of ICU beds totally available, those beds are likely not available in regular hospitals and may only be available in specific pediatric facilities, some of which may be hours away from people's homes. Further, just because there's an increase in the ICU beds doesn't mean that there's a spot to put those children once they're no longer in need of intensive care. This is a disturbing trend that is going to have negative consequences, and of course, there is some concern of what happens when these pediatric floors reach capacity. Now, when we go back to the article from the Times for one moment, it says here that hospitals that no longer admit children rely on transferring them to pediatric units at other hospitals. But when even the largest pediatric floors in the country are at capacity, the pileup of critically ill children in ERs can cause patients' conditions to worsen. In fact, we've had situations where ER doctors in the Boston area wrote that basically children shouldn't even be there. Every ICU for children in Boston is full at this one time, and the nearest open beds were in places like New Haven, Connecticut, and Vermont. The doctor who sent the text message considered intubating the child in the ER while he waited for a closer bed to become available. And this is really disturbing. And when we look at some of this information, we're seeing some pediatricians addressing this in real time, more or less. In fact, a pediatrician who was asked, "What have you seen in your own experience? I mean, how does the loss of pediatric beds in hospitals affect children and their families directly?" The response was, "So the biggest thing we're seeing across the country is kids having to wait or travel long distances to get definitive care. And by definitive care, that means you show up to a place and you have a condition that gets treated, and the child gets discharged and is better." And what's happening now is in rural areas, they have to travel very long distances to children's hospitals. And even in urban areas and many states like Massachusetts and Maryland, many community hospitals in the suburbs have shut down. So even if a child shows up not that far from the children's hospital, they still might have significant wait times to have to sit in general ER for hours and hours waiting for transport to that children's hospital. And that delay and care has a risk. It has a potential of a child getting worse, or maybe a potential outcome like they didn't make it when they should have. And so we're seeing these extended wait times that could have substantial impacts on the lives of these children. And when we consider some of the things that we've talked about on this channel recently, where we're seeing microplastics in children, where we're seeing that some fetuses are taking in things like coal dust and all sorts of carbon into their organs before they become children and are born, we're seeing a trend where children are getting neglected in this system in mass. And the fact is that some children are needing to travel all of this time in order to get care. But the fact remains that while they're traveling for these medical needs and they're having to wait for extended periods of time, their illnesses are getting worse. And we're seeing all of this and starting to see the results of this kind of catch up with us with this recent outbreak of respiratory syncytial virus, which is been hitting a lot of children. Now, we have here an article from The Hill. Some children's hospitals across the country are being overwhelmed with patients suffering from respiratory illnesses. Respiratory syncytial virus, RSV, is on the rise, according to the latest data from the Center of Disease Control and Prevention. Cases have spiked specifically in the Northeast and the South. For the last few weeks, Connecticut Children's Hospital in Hartford had been over capacity as more and more young children have been admitted for RSV. The hospital is now talking with the National Guard and FEMA about setting up a tent outside to expand its capacity. We just don't have as many critical care beds for children as we have adult critical care beds, simply because we don't usually need them. And the fact of the matter is that maybe they didn't need them, and maybe that's why a lot of these places are cutting costs. But the fact remains, when you see one facility shut down all of its children's units, right? All the medical care for children is taken out of a hospital. And that happens to not just one facility, but three, four, five, or six facilities that will all then send people off to the same pediatric hospital. You start to see a situation where that pediatric hospital starts to reach capacity that much sooner, where one outbreak ends up overwhelming the entire system. And it's not just this type of care for RSV that we're seeing. We're actually seeing situations where, for example, in rural communities, pediatric closures have made it so that certain illnesses have required extended travel times. The 16-year-old in Texas had to be homeschooled so he could travel 8 hours to Dallas for dialysis treatment 3 times a week. Meanwhile, another person, a 2-year-old with an autoimmune disease in Fort Kit, Montana, routinely takes an 11-hour trip to Billings, Montana to receive infusions. This is the type of thing that we're seeing because of the way these for-profit models are working. It's not working for children. And the fact is, they'd rather pay for an adult to have a bed, or they'd rather make sure that an adult has a bed and pays for extensive amounts of testing rather than have a child take those beds. So, in the midst of this outbreak and all these other cases, we're finding that children across the country are in a place where hospitals are shutting down their children's units when we don't have enough space for children in some of these units, especially in the Northeast and South. This leaves long wait times, and pediatric hospitals are often a significant distance away with long wait times. Again, in the meantime, there are far less beds available in total. Even if the ICU beds are available in these pediatric hospitals, where are they supposed to go after? And this is the outcome of a system that prioritizes profit and finances over medical care for children, given that it's far more profitable to provide more expensive procedures to adults. The fact is, as I mentioned before, an asthma case for a child will never provide the same amount of money to a hospital as something like, say, a triple bypass in an adult. No matter how the insurance system was changed or modified, no matter how much they try to blame the Medicare system or Medicaid systems, the whole fact remains that they will never reach those levels of expenses. And so there's not an incentive for these hospitals to purchase the proper equipment that is needed to specifically work on children, to hire the staff that specifically works on children, and of course, to have the beds available for these children when they can replace them with unhealthy adults. And the unfortunate reality is, we keep looking at this profit margin and the for-profit system instead of the human conditions and outcomes in these life-saving medical facilities. And we need to be protecting this infrastructure and turning it back into what it's designed for, something that is designed, first and foremost, to save lives, no matter the cost. Because to do anything else is vile and wrong. So with that said, if you've learned something here today, consider liking the video, subscribing, and leaving a comment, as well as consider joining my Discord where we talk about topics like these. If you're in a financial place to do so, and only if you're in a financial place to do so, please do consider supporting me on Patreon. That is linked in the description down below. It goes a long way to helping the channel, and it's very helpful because a lot of political content can be demonetized on YouTube. Again, the links for everything that I mentioned are in the description down below, and with that said, my name is Anarchist Tara. Thank you so much for watching.